Yeah, I think it's helpful to understand the five gross physical channels enumerated within the Gyushi for the the winds. So while there are whole volumes and commentaries written about the chakras and channels, it all really stems from understanding how these five work with the physical form. And so again, it's just really important to just state that it's vital that you seek instructions from a very qualified master. And I studied with a shaman once who told me that if you see shaman on the business card, run, don't walk. So I think that's true a lot now, as well as people are becoming certified in this or that. I think it's not going to be very long before we see people saying that they're certified in wind practices or whatever, which is
Oh,
a terrifying thought to me. Um, so just be careful that people seek out teachers and observe their quality and character for a good long time before diving into any advanced practices. But I will explain the five primary wind channels according to Tibetan medicine.
mhm.
So the first one is the life-sustaining lung. So this is the Dzogchen lung. So many people have maybe heard of this Sok lung or the Soksa. It begins at the crown of the head. Its pathway is the pharynx and the esophagus, and its primary function is swallowing, inhaling, sneezing, spitting, belching, clearing the perceptions of all of the sense organs and mental constructs. It is responsible for governing and integrating all mind, body, spirit systems. So when it is disordered, there are a variety of physical or mental aspects that one can see. And specific examples of this include confusion, hearing sounds, having hallucinations, being very likely to easily lose one's balance, like physical balance, and even to experience loss of consciousness. So, when we talk about a Sok Lung disorder, this is literally the life-sustaining channel, very often has an increase of an excess amount of wind. And this can actually happen quite easily when doing meditation practices that one is not quite ready for, because it is the central channel wind. And so people can have symptoms of quick to anger, feeling uneasy, extreme depression. Um, a lot of times, the people that you see on the street that are homeless, that are talking to themselves, this is a Soklung extreme level of disturbance.
Mm.
So that could be schizophrenia, for example. Bipolar manic states are a great example of that. So insomnia can become a huge problem if this is not balanced. So that is the Soklung. And it's very representative in all statues. Do you know what a Sokshing is? Or
Mhm.
inside of a stupa, a Sokshing?
Yeah, with a
So
pillow.
yeah, it's the pillar inside that represents this channel that is placed inside the statue along with all the mantras that are associated with it. And that is actually what makes the statue awake or
Mm.
alive, the stupa. So it's a very important aspect of being able to move all other aspects of wind. And it is literally the wind that, as we are in the process of death and the wind comes down and then it meets at the heart, and that's when our consciousness goes out.
Mm.
So it's an important wind to keep where it belongs in the right level.
Mm.
The second is known as the Gengyur, and the Gingir is the ascending wind. The ascending wind is living in the torso and the chest, And I think it has a little bit of an association with the pectoral chi is very similar in for the chi that is the chest chi. And so the ascending wind is related to the pathway of the nostrils, the throat, and the tongue. And so it's very much associated with the functions of speech, of regulation of your bodily color. So, like your complexion being clear and having the right color, physical stamina, clarity of mind, sharpness of memory, any kind of like general ability to focus with diligence and have awareness is related with this particular wind. And so when this is disordered into a state of imbalance, it can malfunction and cause difficulties with the upper parts of the body. So breathing disharmonies, lung issues, loss of voice, neck and shoulder pain, sometimes headaches. And so, like a good example of this would be Parkinson's disease when the speech function gets compromised. This is the Lung that is malfunctioned. Or people have difficulty swallowing sometimes, and they have to have their esophagus stretched. This is relating with this particular wind. Oftentimes, people who have endured a lot of abusive relationships, this wind is sometimes dysfunction because they are not speaking their truth. They haven't always been safe,
Mhm.
to be able to speak in that way. And so that clarity of mind has been sort of either suppressed or traumatized, and so it can show up in that way. So um, also speech impediments, that's this wind. So if somebody was born with that, this wind might be a little more weaker if they stutter or Tourette's, for example, that sort of thing. So that is that particular wind channel. The third is called the Kapjelung. And the Kapjelung is what we call the all-pervasive wind. So it begins in the heart. That's its primary location. But its pathway is that it pervades the entire body and it does so via the blood vessels and the blood channels. So this is kind of interesting because when you think about the peripheral nervous system, and the nerve function there. And then also you think about the vasculature. And so you think about circulation, for example, like hands and feet, that sort of thing. So the functions of this particular wind is every single bodily muscular movement or function is related to this wind. So that's walking, stretching, lifting, contracting, controlling, opening the hands, opening and closing the eyes, all of it. So, opening and closing of the orifices, verbal, mental, physical functions all rely on this all pervasive wind. So, it's highly regulated by the nervous system and the brain. And so manifestations and distorted states for this include loss of balance. So again, there's that Parkinson's piece. Think muscular dystrophy, think MS, stress, anxiety can result panic attacks. It's in the heart, right?
Yeah.
So that kind of pressure in the chest, heart palpitations. Um, Lots of discomfort or disease in the heart itself, particularly shoulder and back pain, which we often will see and call Trocklung, which means a combination of wind rising with bad blood up into the upper shoulders. Because remember that this pathway is through all the blood vessel channels. And so it can kind of push that wind up and you just feel it like all from the neck and in here. And that's relating often to stress. People
Mhm.
will really have carry their tension in that way. So we see a direct connection um, to that shoulder or back pain. This is like a mixed disorder with the blood circulation. And so it kind of tends to kind of pony up next to Tipa a little bit. And then we have our fire accompanying wind is the fourth. So we call this the Lung. This is a very important wind. Not like they're not all important, but this one is very important because this one directly relates to digestion. So within the text, it talks about the location of this wind being the stomach, but I'm just going to go out on a little limb here and say that I assert that it is actually much more likely to be in the duodenum itself.
Mhm.
And that is because you know, its job is to sort and separate pure from impure, right? So it sounds a lot like small intestine in Chinese medicine as well, but that's not why I would say that. I would say that because of its function, but its pathway is that it runs through the entire alimentary canal. So its location, according to the text, is the stomach. I think it's right kind of in that first 12 inches, right after it gets through the pyloric sphincter. I have a lot of other reasons why I feel that way. But it actually runs from top to bottom. So the whole alimentary canal is influenced by the fire accompanying wind. It's one of our three maîtres, so one of the three digestive powers. And so its primary function is for regulating the digestive system.
Mhm.
So it's separating nutrient from waste. It's like, ah, you are so fine and juicy and delicious. I will take your little molecules. I will uptake them through the hepatic portal vein and I will feed the whole system. Yum, 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 yum. And you are shit. You will
Mhm.
go away. Yeah, you will go down. So it's like making that discrimination and that sort of decision around what is good for us and what is not good for us. So it aids in the ripening of a chemical state of digestion so that we can really have good nutrients. So it's sort of the first it's one of the three aspects which creates the seven bodily sustainers, which is super key to everything we do in Tibetan medicine. And, you know, hold life together. And it's also ripening the objects of harm. So the objects of harm are feces, urine, and sweat. So it's being discriminatory around what is, an object of harm and what is an object of pure delight and yumminess for the system, for the physical form. So, in a disordered state, this is like leaky gut 101. This is your gut lumen doesn't have great junctures, it can't decide, there's inflammation. You've got, mucus stools, and you can't digest anything, malabsorption issues. So, acute and chronic disorders both are affected by this fire accompanying wind. And so you can have constipation, you can have poor metabolism where it's running really low and slow. You can have very poor digestion, poor absorption, a variety of indigestion states are found in combinations with other energies and this particular wind. So, particularly, it relates with our pagan Nakchi, which is one of the five pagans or earth and waters, and it relates with our digestive bile, so our Tipa Juji. So the fire accompanying wind is really one of the primary things that I'm almost 85% of the time working with patients because digestion is the root of the majority of diseases, and it's the way to reverse it. And then the last one is the downwards voiding wind. And the downwards voiding wind we call the Truselung. And the Truselung is located in the secret place. So it's the anal area, the urethra, the vaginal canal. It's basically the four finger widths below and everything that encompasses that.
Mm.
Its pathway, however, is the urinary bladder, reproductive organs, large intestines, the thighs, actually, and anything below the navel. It rules. So, women having menstrual cramps that go into their thighs is not uncommon, and that's because it's the downward voiding wind that is activated. So, a lot of times people say, I don't know why it does that, but it does. And that's because it's a direct pathway. So this facilitates the ability to either hold or release all waste products and sexual fluids. So releasing of feces, releasing of urine, releasing of sperm, releasing of menstrual fluids, releasing a fetus, releasing placenta, or holding the fetus, holding the placenta. And so malfunctions demonstrate like a lot of lower body coldness, low body circulation, so lower jiao. Think lower jiao if you're talking in Chinese medicine, lower abdominal disturbances, um, like cystitis, for example, or enlarged prostate, or menstrual disharmonies, premature ejaculation, these kinds of things. Particularly reproductive function and abdominal prolapse are relating to this particular wind.
Mhm.
So these are the five sort of gross wind channels that we have, and they're kind of an offshoot of those other channels that I talked about last time we spoke. But they're good to think about in terms of your meditation because when we talk about beginning to have awareness of, meditation, and how it's affecting the body, you can start to see how some of these winds might be affecting you. And so then you would then work on those particular winds, hopefully with like a qualified Tibetan doctor or somebody else that could like sort of work with those particular pathways and channels on a physical level. Um, so it is good to know them.
Mhm. So it's not something
Yeah.
the meditator would do themselves. They would go find a doctor or a teacher.
I would encourage people to start off with somebody that was knowledgeable in this arena.
Mhm.
So certainly they could know, like, oh, wow, she mentioned that about my throat, and I feel that, or I have that. And, how do I work with that particular wind? So you're never going to go wrong doing shamatha. Never, ever. Never. Um, but in terms of, there are different things that, might be useful for the upward rising wind.
Yeah.
So like clove, for example, would be
Ah,
great. Um, and so there's subtle things that one might be able to do on their own, but it is good to sort of start with somebody who can like start to make the connections to what those channels are doing in the
yeah.
rest of their world. Oftentimes we try and target something, and the problem with targeting one thing is that we are a whole being that might need more attention than that. So yeah,
Hence
yeah.
why shamatha is such a safe bet.
Yes, exactly. You can never go wrong settling the mind.
All right, great.
Yeah. All right.
Um, well, thank you so much. I mean, you're just a wealth of knowledge. I really appreciate this.
Yeah, no problem. Thank you so much for having me.
Yeah, thanks for coming on again. And hope we'll do one more, hopefully.
Okay. All right.